From Robert Wood Johnson University Hospital, this is Medically Necessary.
Welcome to Medically Necessary, the official podcast of the Robert Wood Johnson University Hospital medical staff. I'm Chris Hoenig, joined as always by Dr. Jim Salwitz. Dr. Salwitz, how are you?
Nice to be with you, Chris. I'm doing well. Yours are safe, I hope?
Oh, yes. And a beautiful day in the medical neighborhood. Of course, digging out of our snowstorm we've had here recently. And, we're coming up on the holidays. We're coming up on the end of the year. Dr. Salwitz, we would be remiss if we did not thank you for all your years of service, 6 years now as our medical staff president, your term coming to an end, your podcast hosting duties not coming to an end. You're stuck with us there, but your term as medical staff president coming to an end. So thank you so much for all you have done for the hospital, for our clinicians here over the past 6 years.
Thanks, Chris. It has actually been a tremendous pleasure and an honor. It is a wonderful institution, and wonderful people, so it's been a work of love, if you will. But thank you very much.
A work of love that has been very difficult here over the past 9 months or so. COVID-19, obviously this pandemic continuing, the second surge here in New Jersey, the second surge here at Robert Wood Johnson University Hospital. And right now I'd like to welcome in our first guest, Sally Wells. She's the Business Development Liaison for Robert Wood Johnson University Hospital's Blood Services. Sally, this is something we saw during the first surge here, another critical blood shortage happening right now in New Jersey. Compared to the first surge, what are the supplies like these days?
The supplies are critically low, particularly when it comes to certain resources such as type O blood and single donor platelets. I think that it's important that I mention the difference between the first surge and this surge is the fact that during the first surge, we shut down. So there were fewer needs, if you will, other than chronic users for blood and blood products. But with our ORs still running at full capacity, coupled with the fact that there's been huge increases in trauma, and then add into the mix that the big suppliers, the American Red Cross and the New York Blood Center, are not able to meet our routine supplies. It's really quite the dire situation.
I was on a call the other night with the governor, who has underlined his commitment to not cutting back this time around on conventional, on routine services, quote unquote, elective services, which just shows up that, we're not going to fix this blood shortage by suddenly not giving as much care. And unfortunately, as you point out, trauma in the spring kind of went away. I mean, people sheltered down and they stopped, hurting themselves in car accidents and other events. And so, there really is a significant spin up, in services as we go forward here.
I think that we have a unique opportunity at Robert Wood Johnson University Hospital to connect with our physicians and with their patients in an effort to ask them to support the blood donor program. Understandably, it's not the patients that are going to be donating blood, but their connections to their loved ones, their connections to their family members, to the community, I think could make a huge difference in our fixed site center and clinical academic building. I think that we could do a more robust job reaching out to certain partners within the medical community that we serve and ask for their involvement in blood donor relations. But if you look at the academic medical centers throughout the country, many of them have very, very strong programs whereby they are working closely with their communications folks, their educational folks, their physicians to do education on the grassroots level when it comes to their patients so that their family members, loved ones can get involved. And that's one thing that I would love to see have happen. I've been with Robert Wood for 23 years now in different roles in the blood services, and I have watched it evolve, and I truly believe that that is one way that we could make a very big difference in our self-reliance on blood and blood products, particularly platelets.
So you're actually talking about building a culture that of donations, if you will, to support our own services to some great extent, and integrating that with our physicians, our patients, and the community locally, not depending, if you will, on the outside world, for lack of a better term.
Absolutely. Now, we'll always be dependent on the outside world because we're such a huge user of blood and blood products. You know, we're using, on average, between 25 and 30 single donor platelets a day just in the Cancer Institute.
Wow.
Our capacity to collect in our donor room is somewhere around 10 products a day. That's it. So we will 10 single donor platelet products. So we will always be, or at least for some years, be dependent on outside suppliers. But 20% of our overall supply is not out of reach if we could work together to continue to get the word out about the need and to do some grassroots education.
No, that's really important.
So we look at this overall need and the constant use. Robert Wood Johnson, as an academic institution, our donor center here has also been critical during COVID-19. Anybody that tested positive for antibodies in the study in the Courtyard was given information about donating that plasma, the convalescent plasma, at our donor center. What was the response like, especially from our staff here at Robert Wood Johnson, in terms of that convalescent plasma donation?
So we had a good response. We collected from early April through the end of June. We collected about 220 units of convalescent plasma.
Wow.
At that point, we had a sufficient supply, not only to meet the needs of the patients in-house, but in early July, we shipped product out of our freezers to some other Barnabas Health facilities to store and manage for us, so that if we had the need to continue to collect, we could do just that. I can't tell you at what point that inventory stands today, but I can tell you that during that surge and during the initial need, our staff and some community organizations that we worked with really rose to the occasion and helped us collect some convalescent plasma for our patients.
It's interesting, Sally, because you're therefore saying that given the proper organization, motivation, focus, we clearly have the ability to build a kind of culture of naturally sustaining transfusion medicine, if you will. And this is it's a change that we have to build towards, but we're capable of doing it.
Yes, I agree. And I've seen, again, over the years, I've seen multiple examples of that. During the initial surge, April and May in particular, we had a tremendous amount of physicians and physicians' families who, thank goodness, were well and healthy and made it a point to make an appointment to come up to the donor center and donate blood and platelets. The medical students were extremely engaged in the process, reaching out to their peers, reaching out to other people that they know, not just in our immediate community, but throughout the state of New Jersey, and encouraging blood donation. I'm not 100% sure what the motivation was. I know that at that particular point in time, many of the clinicians in the hospital had more time than they might today. And time sometimes is of the essence when you need to walk up to the donor center and take an hour of your day, or in some instances 2 hours if you're donating platelet. So I think that played a part. But other than that, it was that feeling of being able to do something good when there was not much else that any of us could do except to go to work every day and do the best we can, not knowing what the end result of the surge was going to look like. The overlying need to be involved when you really couldn't be involved. It was an opportunity for people.
Times of crisis do bring people together in ways that normal times may not. And so for anybody looking to donate now, how can they get an appointment at the donor center to do so?
The easiest way for people to schedule an appointment is online at RWJUHDonorClub.org, or they can call our reception desk at 732-235-8100, extension 221. Besides the donor center, there are also opportunities throughout the area and throughout the state. If somebody lives, for example, in another area in Somerset County or in southern Middlesex County or in Ocean County, we do run blood drives in those areas as well, and people are always able to make an appointment at any of our blood drives.
Well, thank you, Sally. We appreciate the information. It's really critical to get this out because unfortunately we're in a time that we need us all to band together, support each other, because it's going to be still a challenge. Even with the new vaccine, it's going to take some months before this crisis, this surge comes under control. So thank you so much for taking the time. We really appreciate it.
Thank you. Be well.
Sally Wells with the Robert Wood Johnson University Hospital Blood Donor Center. We talk about this being a time to come together, support one another. It's also a critical time for our medical staff, especially to look to support the hospital. There's the physician giving campaign going on right now from the Robert Wood Johnson University Hospital Foundation. We'll sit down with Dr. Mike Nissenblatt and Dr. Arthur Perry to talk about that right after this. We'll be right back.
What makes a hospital an academic medical center? Being one of only 7 nursing programs in the world to receive the Magnet designation 5 times. A nationally recognized children's hospital with specialties including regional perinatal care. A neuroscience team closing in on the nation's 3rd largest killer. A partnership with the Rutgers Cancer Institute of New Jersey. Cardiac medicine, where hope is transplanted along with hearts. A comprehensive liver disease and digestive treatment center. A bariatric program with long-term results. And a level 1 trauma center that's above it all. Research, education, patient care, everything you'd expect from New Jersey's premier academic medical center. Robert Wood Johnson University Hospital. Let's be healthy together.
Medically Necessary, the official podcast of the Robert Wood Johnson University Hospital medical staff.
Welcome back to Medically Necessary. Chris Hoenig here, joined by Dr. Jim Salwitz as always. And Dr. Salwitz, you know, we're coming up on the end of the year, so I have to ask, any New Year's resolutions?
Get the COVID vaccine.
Well, that's an easy one. I think that's an easy one.
You know, that is my first, and since it's 2 shots, it's my first and second wish for the new year. I mean, otherwise, just recover, rebuild. 2021 has got to be a more positive year than the one we've just managed to fortunately survive.
Yeah, you always look at it and you figure it can't get worse, but then you never say that part out loud, right? Because then it somehow does. And as we come to the end of the year, we're also coming to the end of the physician giving campaign here at Robert Wood Johnson University Hospital. And so with that, I'd like to welcome our next 2 guests, Dr. Mike Nissenblatt from Regional Cancer Care Associates Central Jersey, one of your partners, Dr. Salwitz, who is also your co-chair on the physician giving campaign, as well as one of our physicians who has donated to that campaign, Dr. Arthur Perry.
And I think it's also really critical to point out that that Mike and his wife Marlene, for this particularly critical building year of the physician giving campaign, offered a match to anyone that donated to the campaign this year, which was an extraordinarily generous offer and showing his commitment. So it's not only a co-chair, but he was also literally a sponsor, of the campaign itself. And this is reality is RWJ, for whatever it is, the does not have a long, deep culture of physicians giving to the hospital. And most other hospitals have much more successful physician philanthropy program. And I think Mike recognized this as being an important thing to invest in, if you will. And then critically having Art here, and someone who recognized that this is important, to build this institution, particularly this time. So thrilled to have both of you here.
And I think that's where I'd like to start. Dr. Nissenblatt, what is it that drove you to take on this commitment as the co-chair of this campaign?
Working in this hospital for so many years, it's the best spot I could ever have dreamed of. I never, ever thought after coming out of training that I would have an opportunity to participate and contribute to an institution like Robert Wood. The fact that it happens to be late December also tells us that the world is darkest just before dawn. And we're about to have a new dawn, not just in overcoming COVID, but one of the things that this COVID pandemic has done has been to inspire extraordinary cooperation, extraordinary accomplishments by this institution. It's almost like a butterfly in its chrysalis that it had been incubating for a long period of time, and it's about to be reborn, and to be born from a capacity that appeared to be very limited to one that has unlimited capability. The ability to help others is hardwired in humanity. There's a couple of great books out there right now. One is by a person by the name of Rutgers Bregman, who's Belgium. And the name of his book is called Humankind, a big emphasis on the kind. And the other book just came out a couple of weeks ago from Princeton by Augustin Fuentes, which is called Why We Believe. He's not a prelate, he's not a religious individual, but he describes belief as having a commitment in a particular ideal rather than having particularly structured phenomena that we associate with religion. But both of them emphasize the fact of cooperation is more important and it is hardwired compared to competition. And trust is hardwired compared to distrust. But the more important one is that alliance is more hardwired than is defiance. We have in this institution an extraordinary capacity. I admire Jim every single time he's given one of these updates, every day, every week, sometimes several times. It's incredible. He's a wonderful leader. When I first came to Robert Wood Johnson, to Rutgers, Jim was one of my students in the audience. We've become fast friends ever since then. We have arguments just like a husband and wife. I want this institution to be the most successful one in the world. I remember some of the earlier presidents when I was here, John McFadden, Bruce Topolowski. Then Harvey Holzberg came along a few years later and said he was going to make sure this was one of the top 10 institutions in the country. Let me tell you something. If you go back a little over 100 years, 1910, we had a famous person by the name of Abraham Flexner. He was a little man, 5'2". He had blue eyes. He was a second grade teacher. He was from Mississippi. So a little man. But he had this enormous capacity to pick out character, to pick out capability, to pick out talent. And he was selected by the United States government to survey all of the medical schools in the United States. There were 155 of them in 1910. And he came out indicating that literally all of them, because most of them were proprietary, meaning profit-making, should be closed. Within 2 months, 30% of them were closed. And by the end of the year, about 80% of them were closed. And he picked out certain institutions that were models, in which there was a hospital, like Robert Wood, a university, like Rutgers, and a medical school, like Robert Wood Johnson. And the cooperation together represented the finite, necessary fuel to create an institution that could provide new information, overcome illness, and add to the world. Flexner was then chosen, by the way, to create the Rockefeller Institute. And then he started the Institute for Advanced Studies in Princeton, and he's the one who brought Einstein up here. Well, Robert Wood Johnson is very much an institution that 110 years ago would have then have been closed down. But now it will be at the forefront of leadership because of the critical mass of scientists and educators and compassionate physicians, all of whom are on staff at Robert Wood Johnson University Hospital. I am very proud to be part of this institution. I want it to succeed. I want every doctor to make some contribution, whether it's $25 or $25,000. Everyone needs to contribute something. We are in the midst of an historic evolution, and we're in the midst of about to give birth to a world-renowned hospital and university. And I'm just proud to be here, and I want to support it. And my wife, Marlene, wants to support it.
Mike, thanks. I mean, obviously, everything you said is near and dear to my heart. You know, we're building here, the potential here, the people here. And I think that your point about COVID being a part of an inflection point in time happens to line up with several other simultaneous inflection points, but a critical moment, and therefore a critical moment for people to say, yeah, this is really, really important to the future. I think to follow an analogy you were aiming for, I mean, I think one finds meaning in life by creation, and I think this is part, of that creation. So, and I just again to thank you for medical staff for your personal commitment. It's really important. So, Art, what made you respond positively to this request at this time?
Well, Jim and Mike, as you know, I've been in the medical community here at Robert Wood Johnson since 1987. Of course, I was in high school then, but but I came to the institution when it was so much smaller and so much more limited, and I've watched it grow as you have, and been very proud to be part of this wonderful community. I've been part of it on very many levels, not just as a practicing plastic surgeon at the hospital, but as a recipient for my family of medical care. Robert Wood Johnson has taken care of both of my parents and my wife. And, they've actually, the hospital and Dr. Nissenblatt in particular, have saved the lives of 3 of my family members more than once. And in a dramatic way, my father was airlifted to Robert Wood Johnson when he was going to die in upstate New York about 10 or 12 years ago. And his life was literally saved by being airlifted from upstate New York to here. When you have that kind of hospital in your community, that's a wonderful thing. And it's so important for all of us, the medical staff and the community members, to support the hospital. I always say you never know when you're going to need it, and we all will at some point. And, I hear stories of people, they want to move to some remote location, and they forget that one of the most important things about where you choose to live is where you're going to be taken when that ambulance picks you up. And heaven forbid you go to a place that's not the caliber of a Robert Wood Johnson. Literally your life is in danger. So as a physician, as a member of the community, I think it's so important to support the hospital, the programs. And the truth is, when Mike Nissenblatt asked me to support something, I do it, because when Mike takes care of you, that's a very special thing, and I'm always happy to reciprocate.
Arthur comes from a remarkable family, a very remarkable family. His mother was very instrumental in a political party in upstate New York for many, many years. Well-known, I'll use the word character, a well-known person with a lot of character. His father was a dentist, a terrific dentist with an extraordinary sense of humor that flowed downstream to Arthur and could cite poetry, usually humorous ones, constantly. But he in turn has given birth, and Badana has given birth to 3 rather extraordinary children. Their youngest is Julia, the middle is Meredith, and Ben. And they're all extremely, extremely creative kids. And I'd like Arthur to So I want to tell you that one of them was actually named to one of the top 30 young people under the age of 30 in the whole country. And was on the cover of, I think, Time magazine, or maybe page 8 of Time magazine. But all of his kids are like that. And this is the kind of person who's supporting Robert Wood. Tell us about those, Art.
Well, yeah, you're judged in many ways in life, and one of the ways is what kind of children you create, right? And I have 3 great kids. Yeah, my daughter started a company, and quite successful. My all 3 of my kids have been extraordinary, and it's a blessing to have them. And I raised them with my wife, who passed away earlier this year from ovarian cancer, but she, you and Jim and the hospital kept her going 14 years, long beyond what statistically she was expected to be alive for. And how could I be more indebted to you for doing that? But so what goes around comes around. We want to really support the people that supported us.
It is a remarkable community that is going through a critical time. And I think it's very interesting to think about the 2 private practice physicians who practice at a level that it clearly competes with any academic institution anywhere, as far as the quality of care the 2 of you have given and your commitment, how they are so committed to the building of an academic center. And by creating an academic center, building a better tomorrow. It's, as you say, Art, it's very important to know that you have a good hospital in your community to take care of you, which tragically through this COVID thing we're seeing around the country is not always the case. That's important, but it's also that both of you are inspired by a better tomorrow, and that commitment. And I think it's fascinating to think of private practice physicians, having, that commitment, to building. So it's, I deep respect for both of you in having that view. So it's interesting.
And Dr. Perry, I would be remiss if I did not give you the opportunity to plug your radio show. And I don't know if it was the same time, but you and my father may have crossed paths at Rutgers Radio, because he was at Rutgers Radio in the early 70s. So that's how I ended up following that path. I have that, I guess you could say, that gene.
WRSU, 1974 to 7. It was those were fun years. It was a great radio station. I'm on WOR in New York now. It's 6 o'clock on Saturday evenings. I can't imagine you all haven't listened for the last 16 years. every Saturday. What else is there to do? I'm opposite cousin Brucey, who's on ABC now. So that's a tough one to go up against. But if you're interested in medicine or plastic surgery or what you look like, listen to my show.
I feel sorry for cousin Brucey.
Oh, yeah, I'm sure.
He needs to knock on your door.
Well, Dr. Arthur Perry, Dr. Mike Nissenblatt, thank you so much for joining us today.
Pleasure. Thank you.
Thank you very much.
Really appreciate it.
And as always, you can subscribe to Medically Necessary on your favorite podcast platforms: Apple Podcasts, Google Podcasts, Spotify. We're also on YouTube, and we have that link on the Robert Wood Johnson University Hospital Medical Staff Portal. For Dr. Jim Salwitz.
For Chris Hoenig.
Thank you for listening.
Thank you so much.
Medically Necessary, brought to you by the Robert Wood Johnson University Hospital Foundation.